to say something that will cause problem in the Nigerian medical system. And I don't care, because I be man where they stand for the truth all the time. Now you understand why they say, now God they save us for Nigeria. You see that statement, now God they save us for Nigeria. Now you understand them. If you dey Nigeria, don't pray to be sick. If you are sick, you can't reach where they no fit handle them. Don't know say na die, na be the next thing. If you know the number of people who don't die for Nigerian hospitals because they couldn't find out what was wrong with them, you go pity yourself. How can a whole hospital say they have checked everything, they didn't see what is wrong with you? That statement alone, like I don't understand. Your duty is to investigate, assess, estimate, treat, and manage the patient. You go say they don't find everything what they do and they don't see. What kind of statement is that? Sometimes they wonder, they say that British colonized us. Is it that we didn't learn well, or they taught us wrongly? Because I don't understand. Don't come here and tell me what you don't know, because I am talking as a medical person that worked both in Nigerian hospital and working now in the UK. Our medical system in Nigeria is dead. I worked in one of the best hospitals in Nigeria. I worked both in private and in government hospital that have the so-called equipment you people think. Nothing to be compared to what is happening here in UK. But these politicians will come here. They don't want to make our own hospitals to look like Nigeria. Do you know what is happening in Nigeria? You know, say lab for Nigeria, no, they fit diagnose anything. Do you know how many viruses they get for the whole world? Nigerian laboratory can only diagnose only 3 viruses. HIV, hepatitis B, and hepatitis C, or maybe this COVID will just come. The kind HIV not be the real test they do. The way they do no they sensitive. Now, determine that they use. They go come use Unigold and Star Pack. Say na for confirmation. You go come toss a person get HIV. You will not understand this until you have practiced in the UK. Then hospital where they try go come use a ELISA machine, enzyme linked immunosorbent assay. Where we say for the whole southeast, now only teach hospital Nnewi for Anambra and Feta for Abakaliki for Ebonyi State. Now get that ELISA machine. And they go use ELISA for you when they don't say you they die. They no one cause more problem for you. Then when they go use the ELISA machine. We know that. Do you know how many viruses were they? Rotavirus, cytomegalovirus, rubella, measles, influenza. Do you know how many infection mononucleosis? We cannot, as in Nigeria, cannot find it out. That is why they go check, finish. They go say they don't see what they do you. The person go they die. The person go they die. Do you know about latent tuberculosis? You know how many people from Nigeria will get latent TB? You when they listen, not be matter of God forbid the blood of Jesus. You feel get latent TB now, you don't know. Many people get them. Me personally, I get them from Nigeria. I don't know until I come this country. Latent TB, I say you get them. You know go feel infect them, give another person. You don't dare your body. But you go wait for you until 60-something years when your immune system don't come down. The thing go come out. You go come turn to active tuberculosis. You go come start to the cough, come the slim. Small time you go the cough out blood. They go say they give you poison. Small time the person don't die. You know what it is? Many people, it is common. They say 70% of youths get them for Nigeria, but it's still they passive. As in it they latent, it they somewhere for your body. You know go show until 30th. Nigerian hospital cannot diagnose it. Now when I come this country, they find out. They come begin, they give me drugs. Come check, come say the thing don't come out. But I did okay, I was looking healthy in Nigeria, like most of you are looking healthy now, without knowing, because Nigerian lab cannot diagnose it. Highest they make a Mantos test. Maybe if you go do GNS party or do X-ray. The kind of equipment I don't see for this country. Wait, all these our big men, can't they gather together, bring out money, build one very sophisticated hospital? They can't roll this equipment. They cost some of them now $10,000, some $20,000. Can't we do it and employ, bring people from Nigeria, train them in the UK, let it be standard? Oh, when the young men in Nigeria, they know they do anything for Nigerian hospitals. Trust me, at the face. At the face, people they die every day. Nothing is happening. Nothing is happening. Hepatitis B person go get them, they no fee manage them. They go carry person go hospital, they go put drip, they go put injection, they go do good. The person go die. I know when we talk about Nigerian nurses, we go they call patient by the disease when they suffer. You will all go again, that man will get HIV. You go give that man will get HIV. Which kind to be that? Listen, guys, make una pray, make una pray, make better person win this election. In fact, see, pray not to be sick. When we are men and Nigeria, see what they do for typhoid. You just about in a typhoid test what they do. Everybody for Nigeria, one small thing they go send a malaria and typhoid they do. But not be what they do you. Every small fever, malaria and typhoid. Una own too, una self know they try. Some more headache, you go carry paracetamol. Wow. Before they go prescribe drug for you for this country, they go don't know how the thing reach. Do you know what is to prescribe to give you drug? Normal Ciprotab before because they know the effect of drugs in the liver. When they take my drug, do you know every week? The nurse go they call me for phone. They ask me, "Are you okay? Are you all right?" They go come, they collect my blood sample. They check whether my liver they okay. So they carry the drugs. Just because they don't want to cause problem in my liver because I am taking the drugs. Who want to do it for Niger? They go they give you drugs. More time you don't get kidney problem, liver problem, heart problem, everything. From where they want they cure you. Some people say now for hospital they kill them. I'm just angry. Una own any small thing, you don't have paracetamol. Imagine the content of paracetamol. Paracetamol contains one of the most dangerous components, acetaminophen, very, very dangerous to the liver. You just the child, small time now you don't get liver problem. You go send a village people. Pray make you know they sick for Nigeria. Our medical system, yasa. Doctor and nurse go they worry. Anything we are supposed to make the system strong, we are go they worry. Doctor, medical scientist, nurse, this the rubbish, get out.